Good afternoon, friends. Myself, Dr. P. Samuel, Assistant Professor, Department of Biotechnology, Bishop Eber College, Trichy. In this video tutorial, we will be going to see about urinary tract infection. So, before commencing the topic, I would like to submit the credits for the images I am using in the presentation to BioRender, an wonderful tool for your presentation to equip your presentation with suitable diagrams. I am using all those diagrams from BioRender. You can also use it. So, let us move on to the first slide. What is actually urinary tract infection? It is an infection in any part of the urinary tract. So, it is an infection. Infection can be defined as any damage, right? Any damage caused by a microorganism to the cell or to the tissue or to an organ, that is called infection. If infection is not treated, it leads to disease. So, as per the definition, it is an infection to any part of the urinary tract, any part of the urinary tract. So, these are the organs which comes under the urinary tract, such as kidney, ureter, bladder, and urethra. So, infection in any part of this system is commonly called as urinary tract infection. UTIs are most common type of infection, particularly in women. So, they are predominantly affected by this infection. In some cases, it may also found in man and children's, right. This is the example for the urinary system of human beings. The bean shaped organ is called a kidney, you know that. So, from the kidney there is a tube like structure, right, and this is called ureter. And below the ureter, this is the place called bladder, and bladder where the place the urine is temporarily stored. So, from the urine it is expelled through the urethra. So, as per the previous slide, infection in any of this area, maybe kidney, right, maybe kidney, or maybe ureter, or maybe bladder, even in urethra, the infection is said to be urinary tract infection. So, what are the causes of the infection, right? So, UTI is usually caused by bacteria. Predominant reason is bacteria. And how the bacteria causes infection? It enter through the urethra and travel up to the urinary tract. So, it gain access into the body through the urethra, and from the urethra it ascends into the urinary tract, right. So, the most common type of bacteria is E. coli, which normally found in the intestine. E. coli is called as opportunistic pathogen, right. When the immune system of the host is um, getting reduced, and that time this bacterium, this normal inhabitant of the intestine, so called E. coli, will transform itself into a pathogen. So, it is called as an opportunistic pathogen. Other bacteria such as Staphylococcus aureus and even Klebsiella pneumoniae are also found to be causing this infection, and Proteus mirabilis. So, these are the common bacteria found to cause urinary tract infection in human beings. What are the symptoms of this infection? Right? Maybe frequent urination, a burning sensation when urinating, cloudy, dark, bloody, or strong smelling urine, feeling the need to urinate even when the bladder is empty, pelvic pain, and fever. So these are all the symptoms, right, of urinary tract infection. Next slide. And the symptoms of kidney infection. If if the organism or the bacteria ascend gradually into the kidney, then the kidney becomes infected, and that condition is called pyelonephritis. Pyelonephritis. And these images are taken from smart.surveyor.com, which is known for medical images. You can also use it, but upon reproducing the image for educational purpose, kindly give the credits to the team. That is very, very essential. Unless or otherwise, it will come under copyright violation. So to prevent that, I am giving the credits to smart.surveyor.com. Right. So what are all the symptoms of kidney infection? Maybe fever and chills, nausea and vomiting, pain in the lower back or side of the abdomen, or bloody or cloudy urine. So these are the symptoms of pyelonephritis. Here there are two conditions. One is acute pyelonephritis, another one is chronic pyelonephritis. Chronic in the sense for a longer duration, or the infection is prolonged for more time, more months or more years, right? Nephritis refers to, that is a common term used in the field of medical sciences, used to refer inflammation. Inflammation. So in nephritis, the nephron becomes inflamed, right? So to mention that, they are using this technical term. And what are all the risk factors, right? And certain factors can increase your risk of developing UTI. What are they? One is being a female, having a history of UTI. If you or if your family members are having any pre-reported form of UTI, may have a chance to develop urinary tract infection. Having sexual intercourse, using a diaphragm for birth control, having diabetes, having a weakened immune system, having urinary tract abnormality. So these are all considered to be the risk factors for developing UTI. And is there any preventive measures? Yes, of course, there are plenty of preventive measures. We'll see one by one. One is drinking plenty of water. It is very, very essential to um, to maintain our body. Urinating frequently, wiping from front to back after using the toilet. It is also very necessary, because maintaining the hygiene of private part is very, very essential in the case of both male and female. Um, Preventing most of the infections, right? Maintaining the hygienic condition itself will help us to prevent most of the infection, even UTI also. Avoid using douches or other products that can irritate the urethra. Drinking cranberry juice or taking cranberry supplements will also help us to prevent UTI. Treatment: usually treated with antibiotics. The type of antibiotic and the length of treatment will depend on the type of UTI. Probably how the organism is ascending into the human body, that determines the type of treatment to be chosen. Most of the UTI clear up within few days of treatment, right? So treatment is very essential. That too, we should start the treatment even during the early stage of infection. So whenever a patient is supposed to feel any of the symptoms, maybe frequent urination, cloudy or bloody urine, uh, right? Irritating in the urethra. So these symptoms can be considered seriously, so that they can go and consult their family physician for better results. If left untreated, UTI can lead to complications such as kidney damage and urinary tract blockages. So it has to be considered very seriously. If X or Y is experiencing any of the symptom, he or she should immediately report to the physician and get a proper consultation. What are all the common organisms causing UTI? This is very essential, and I have summarized all the things in a small table, right? So gram negative bacteria such as Klebsiella pneumoniae, Proteus mirabilis, Enterobacter cloacae, Pseudomonas aeruginosa, and Serratia marcescens are known to cause UTI. Gram positive bacteria such as Staphylococcus aureus, Staphylococcus saprophyticus, Enterococcus fecalis are also causing UTI. In fungi, this is a dimorphic fungi, Candida albicans, and viruses. Some viruses such as cytomegalovirus or adenovirus are also known to cause urinary tract infection. So this table will help you to recall the organisms and their nature, right? Organisms and their nature. And Escherichia coli, it infects the kidney and bladder, right? It infects kidney and bladder. Klebsiella pneumonia also, it infects kidney and bladder. Check the differences, right? Here I have given an example. Staphylococcus aureus is found to infect bladder and urethra, bladder and urethra, right? So the infection differs. It depends on the type of the organism causing UTI. But to prevent the complication, it is very essential for the person to go and consult with the physician during the early stage of infection. During the early stage of infection. Hope the presentation was very useful for you to understand what is urinary tract infection, and I hope you are very clear about the infection, the causative organism, symptoms, preventive measures, and everything. Stay tuned with me. Bye bye. Thank you.